Hello, I'm Andrew Shore. Welcome to Patient Power. We covered the 2014 meeting of the American Society of Hematology in San Francisco and sat down with a number of leading experts. Among them, Dr. Barbara Eichhorst from Germany. She was one of the lead investigators for the CLL10 study, and she shares with us the results and what it means for patients.
The CLL10 study is a phase 3 study which was designed in order to show the non-inferiority of bendamustine plus rituximab in comparison to the current standard we have in rather young or at least physically fit CLL patients in comparison to the FCR regimen. So I presented here the final results of the study, showing that to our own surprise as well, it appears that FCR is still significantly better than bendamustine plus rituximab with regard on the time of relapse-free time for the patients, as well as with regard to the quality of the response. What we looked at in a meta-analysis, so we combined two studies and looked at the value or the relevance of minimal residual disease in addition to the clinical response, and there we found that it's more relevant to have MRD negativity than having some residual disease, as for example residual splenomegaly. And I think that's especially important for the patients because sometimes when they finish the treatment and initially they had a very enlarged spleen and then the spleen is still enlarged at the end of the treatment, we found out in this analysis what was the clinical gut feeling of many physicians, that this does not matter at all for the prognosis. Those patients with the remaining splenomegaly have an excellent prognosis. And this will guide us maybe in the future that we will more know which patients need more additional treatment, those patients who are still MRD positive, while on the other hand we will learn more and more which patients have a very excellent prognosis at the end of the treatment and which we shouldn't touch anymore.
We have many other interviews with CLL experts, so be sure to check them out. I'm Andrew Shore. Remember, knowledge can be the best medicine of all.